Hey, welcome back. It's January of 2017. This week we're talking about carpal tunnel syndrome. I see a lot of patients that have this. And a typical patient that comes in here has already worn a brace, probably had, some of them had injections, taken some kind of drugs, and even some I've had have already had surgery, up to even 2 times. I have a patient currently, I think, that's had it almost 3 times in one hand and twice in the other. And so the question is, why are these other normal, typical treatments for carpal tunnel not working? Well, what I'm going to do today is briefly explain what the carpal tunnel is, what the causes of them are, and why some of those treatments aren't working, and how we help to fix that. Okay, so I got this little picture here, and in the picture, what we're showing here is the actual picture of the tunnel. Can you see that there? Mm-hmm. Okay. So this here, the pink is the actual nerve that comes through the tunnel. The blue here are the bones, the carpal bones, that make up the floor and the walls of the tunnel. And the ceiling of the tunnel is that ligament there. And when you go and get carpal tunnel surgery, usually what they'll do is they'll come to the side of that ligament and they'll clip it right here, okay? Trying to open up space. There's only one cause of carpal tunnel syndrome, and that is pressure on that nerve, okay? So what are the number of causes that can cause that pressure on the nerve? Well, one of this can be inflamed. You have multiple tendons coming in here that control the flexion of your fingers, okay? And then also the bones, okay? One thing that people leave out, that most medical doctors or your physician that you go and see for carpal tunnel leaves out, is the fact that if those carpal bones are misaligned, they've shifted the shape of that tunnel, causing pressure on the nerve. So what we do in here is we do a number of things. One, we'll come in, we'll check to make sure that you're aligned, and if not, then we'll put those back in. Oftentimes you actually hear a pretty loud audible pop as things are moving back in. We also do, or I also do a myofascial release to try to help push blood into the tendon area, because tendons have a very small blood supply, and so oftentimes when we do injure a tendon through overuse or through an actual injury, they can take weeks and weeks, if not months. Patients that have plantar fasciitis, like we talked about before, sometimes years dealing with that injury. Okay, so what it does is we get in there, we break up the myofascial adhesions, and then also cause the blood to move to that area, and hence helping to heal the tissues quicker. Okay, so aside from chiropractic treatment, manipulating the wrist bones, and myofascial release, there's also nutrition that you can take to help to alleviate those symptoms as well. B6, B12 have both been shown in studies, multiple studies, to help with carpal tunnel syndrome. Turmeric, which is an anti-inflammatory, along with bromelain, work very well to decrease inflammation. Ginger, omega-3s. So when we start talking about the nutrition as well, people go, well, that sounds like a lot of stuff, and that sounds like you just named off like 5 or 6 things, Doc. That's a lot of money. And so what I do here in my office is, once again, pH balancer. pH balancer has, well, let's read it here. It has B6, it has a 725% daily value of B6 and a 2400% daily value of B12. Along with, it also has omega-3s, it has turmeric, it has bromelain, so basically magnesium as well. All the things I've listed off are all in that one product, so you don't have to go out and buy 5, 6, 7 different things to try to help treat this, okay? So if you're experiencing carpal tunnel, and you're tired of it, you want to get it fixed in just a few short weeks, give us a shout. We can definitely help you out. I've helped multiple people up here get past carpal tunnel and it not return. So give us a call. You got our number, but I'll give it to you in case you need it. 429-1900, area code 660. Give us a shout, or you can go online and visit us at warrensburgchiropractor.com. Have a great 2017. We'll see you next week with the next edition. Yay!